yourself.
We can do that before you walk in the room.
Yeah, that would be another idea, to do it before you're starting, or maybe to concentrate, stretch yourself, feel that you're not stressed, and then start, okay? When do you feel that it's time to move on from the hold?
It
You can feel the
depends.
breathing.
When you're ready.
When you're
And
ready?
you
No,
think
but when
that
the client is
When the
ready.
client's ready?
When their breathing slows
When the
down.
breathing different maybe, or change?
There's a lot of things that happen. I mean, sometimes when you're holding the client will try to move around to get
Yes.
more comfortable. The breathing will yield those differences, so you just wait.
You have to feel it.
Yeah,
It's you can't put like a certain time on it.
it's very subjective, so sometimes just wait for a cue.
1 hour later.
Good. Would you do something different in the way that I've done it? How would you do that?
Pull the towel smooth.
So pulling the towel, yeah. You try not to have too much fluff of stuff around, yeah. So try to be as neat as you can, really. So come around here and put it. Yeah. Can I undo the bra? Thank you. Good. What would be your feedback to me now?
Slow down.
Slow down.
Legs.
Legs. Do you see that I'm actually freezing my lower body? Yeah, I don't move it at all. Fast track for backache, so more space and move. That would also slow you down because it's a lot harder to move your whole body. Good. Next one, I continue doing that. How would you do differently what I've just done?
Keep my hands on the body.
Keep the hands on the body. So if I'm from here and I want to move, make a choreography out of it. Yeah. Yeah. Don't let them know that you're moving. Don't make it a segment. Yeah, but just keep moving, you know. So from here, you're there. And then if you want to move there, back. So what would come after? What kind of stroke would come after that? Petrus. Okay. What would you do different now? In the way that I'm doing it.
Try to bend a little bit lower to make your back straight.
No,
Not
but
too low. Yeah.
come closer.
Come closer to the table, okay? So come closer and even. Don't slouch, but come straight over the table. Okay, all right. I think we're ready, yeah? So come closer, because you really need to see it in a lot more detail. Let's say I'm doing petrissage now to which muscle is it? Erector spiny. It's kind of a cool name because it's on the spine, it's erect the spine, yeah? So, and now let's say I felt a local tension there, okay? So I can start doing a technique that's called compression. Now, imagine that you have this small tightness there in the muscle. Let's say we have a muscle here and you have a local tightness, yeah? So what do you think would happen to the blood circulation in this tight area?
Be limited.
Limited, yeah. Why?
course, when it tightens up, the vessels are, they are like strangled.
Yes, yeah. So
No space for it to come
no
in.
space to in and out, yeah. The vessels kind of smaller,
Mhm.
yeah. Good. Also, all the area where the fluid in the cells and outside the cells, you continue, right? Yeah, good. They would be kind of limited in movement. So what our aim is really to go in a local way and just try to compress on it and relax. Compress and relax. And slowly with the compression and leaving it, what I'm saying relax, I meant to compress and leave it. Compress and leave it, you kind of move the fluid a little bit more into that area. Then you can do more effleurage, more pétrissage, but you're trying to really open that area. Yeah. Also, compression will kind of make them aware, make their brain aware of that tension there, and the brain would slow down the nerve system, the nerves that send all the impulse to the muscle. Yeah. Okay. So this is the theory behind. Now, in practice, you can do it in many, many ways. Let's say it's on this side. The first side you can do is with your thumbs. So there are a few ways to do it with your thumbs. You can actually put your fingers this way, but then if you press hard, there is no stability. So I prefer you to work with your fingers. Yeah? And the way to do that, to say, you need to communicate with the client because now your pressure is a lot deeper. So you could say something like, I'm going to press hard on, deeper onto that area. Let me know how the pressure is. Yes, I would like you to take a breath in. And I press down when they breathe out. Good. Can I go deeper? Yes. Enough?
Yeah.
Breathe in. And you wait a little bit. And then you slowly break contact. Okay? And then again, breathe in and breathe out. Now, the second time, I kind of know what to expect from it, so I don't have to communicate as much as. And then slowly you break it.
Do you feel the muscle relaxing?
Yeah, you could. You could definitely feel the muscle relaxing. Yeah, I wouldn't say that now, but you will later on. Okay. So that's using the thumbs. The problem with using the thumbs is that it's very tiring for the thumbs, and you don't want to wear the thumbs a lot.
For how long would you actually do that for then?
You can do it a few times and then kind of ease and do other technique. Yeah. And then you can do it again and then check it to see how does it feel. So every time when you do technique, you check and you treat the same way. Yeah. Yeah. So this is more like pétrissage into that area. Okay. Now I want to show you different application to do that. So first of all, you can put your thumbs and then put your hand, your palm on top of it. And the one that press actually is the top hand. So actually you're not using your thumbs, you're not pushing with your thumbs, and you're not wearing the joint here. Good. You can do it even with your elbow if you want. It's a lot easier. And see that everything is kind of relaxed, yeah? Good. You can do it with reinforced fingers or just with fingers. Or you can do it this way, or you can do it that way. Yeah. Every application that you can use that makes yourself more relaxed and work easier, preferably then. The worst is really the thumbs. We use it, but don't try not to use too much of it. Yeah, because then you start having an ache, and it's kind of a very delicate joint, the thumbs to the palm. You can use your knuckles. If you have a slightly wider area, you can use just 2 knuckles. Now, don't start massaging with. It's a static position. I will have my other finger here, so I could be resting. I can use the thumbs here, or I can use the fingers here. So I can do more pressure here, or I can use the thumbs in a reinforced way. Reinforced is a fantastic way to ease off pressure on your hand and still have a really nice deep tissue massage and not wear your hands.
So all of your movements are static.
Now, for now, yes. I'll show you after a different one, yeah? Good. Another one that I really like, thumbs but supported, yeah? And then use a force there.
So at the same time you press even here.
Not much. It's more in the thumbs.
Just the support.
Yeah. Do you see the reinforced hand, the other hand? There you know that this is where I precipitate all the forces. Yeah. Because if I do that, you know this is light because more weight I put in there. Yeah. Let's talk about body position. Okay. So you have all that. Right. Now, if you do it kind of far, is harder. Yeah? You need to find a position around the table. You see, I really like that area around here because I can come kind of close. I don't want to be far. Yeah? So in here, if I do compression onto this area, it's not going to be great. I would rather be kind of close to. The closer you are, the easier it is, yeah, for your body. Now, your position, try to really put the position in using your weight. So using the front knee, yeah? Actually almost sinking in. Yeah, a lot more in the front knee, but also on the back knee sometimes, sinking in. Rather than that, you're trying to do that. Yeah, so you're bringing your body over it and then you're relaxing your weight. It's kind of nice, so it's amazing to see students doing all this wonderful work with body work, and when it comes to compression, so try to avoid it, yeah? Try to keep your position nicely, yeah? Even kind of come closer. I really like hovering over the client because it's kind of very easy. The further you are, it's harder. And then you need to apply more pressure and they feel tension coming from you. Shall we give it a try? Yeah, let's do that. And after that, I'll show you a variation of the compression that you actually move a little bit. But for now, I don't want you to move at all. Static. Yeah, I mean, no moving on the clients. Or your body, of course, you can always find different ways to do that. Okay, question?
Quick question. Is it only in like really deep tissue sports massage where they use the elbows? On me, for example, they use the elbows a lot.
I don't know.
But it's more, obviously, more intense pressure.
I prefer not to have categories because I like to give relaxing massage and use the forearm and elbow.
Yeah.
You can do it.
Yeah.
You don't have to do just kind of superficial, you know. So you can do
But I'm talking about compression,
massage.
pressure, where they really push with the, you know, like this, but really push with the elbow.
Yep.
Yeah.
You can do it. You have to do it in the right way.
Yeah.
You can't do it forcefully, but...
Just a couple of questions.
Of course.
There are some massage chairs out there that would you advise to use them
Sorry,
for compression?
massage?
There's like a
Like a
hand
knob?
thing, like
Yeah.
Exactly.
Yeah.
Would you advise to use
You can later on. There are some...
What is it?
sorry?
It's almost like...
It's a piece of wood or plastic that you handle it, and it has like a round ball, that you can press. Instead of your thumb, you can press it. Now, the good thing about it is it saves your thumb from doing it. The not so good is that you are lacking a little bit of control over. So our first, don't use it. When you graduate, maybe 6-7 years after that, you can start using it, because then you can control through this device, where are you? Yeah, it's almost like you need to palpate through that. So
Because
not
you
now,
can't, you
probably.
can't feel the client.
can't-
You have,
you
you
can't
have
feel the
no
client, yeah.
contact.
No, I mean, once you locate, for example, an area of tension or something.
Yeah, control it well, not in the course. For now, don't use it.
One more question. So the compression technique, is it only when you find a knot, or do you use it in general?
No. A knot, and that's something that we need to understand, a knot is something subjective. Means you don't have to find it. The client says, ouch. It's really painful. That's the area that I feel pain and tension. That's for us a knot. It's not objective. Sometimes it will be objective, like to feel, oh, do you feel it? And they will say, yes, yeah, oh yeah. But sometimes you would feel a tension here and they say, no, I don't feel anything, I'm fine. But you go there and you don't feel anything and then say, oh, it's really good, it's like a good pain. That's where you need to work. It's subjective, yes? That's what I'm saying, that it's not what you find, it's how they feel. Cool, shall we start then?